Okay, welcome. We are introducing daily situation reports related to Thunder Bay Regional Health Sciences Center's COVID-19 response. I'm here with Dr. Stewart Kennedy, who is the incident manager on the incident management system for COVID-19. You'll notice that we are not socially distancing. We have both been screened and we know that we're both healthy and safe, though we do encourage everyone in the community to practice social distancing. Happy to provide some updates. We intend to issue this daily. So we'll start with Dr. Kennedy. What is new for today?
Well, thanks, Tracy. First off, happy St. Patty's Day. I mean, it's going to be a different St. Patty's Day for most of us, but certainly we have to respect our traditions and move forward on certain things.
And that's why we're both wearing green.
Exactly. But today we have, this is the opening of our COVID-19 Assessment Center. It opened up at 8 o'clock this morning, and the launch went quite seamlessly. The staff was well prepared. We have screened a number of individuals already, and we have taken, and the people coming there have been checked at the Thunder Bay Health Unit as far as they phone them first, as well as telehealth, and the people showing up really are appropriate, and they're getting appropriate work done, and screening is going quite remarkably initially. But again, we want to talk to the public. The only time a swab will be performed is we follow strict medical directives. And so if you show up to the assessment center and you've been told to go there by telehealth or told to go there by Thunder Bay District Health Unit, there's not necessarily going to get swabbed. We'll do our own screening process at the time. The other thing is quite big, is we're beginning to wrap up sort of reducing the level of non-essential services at Thunder Bay Regional Hospital. So we're looking at cancellation of elective surgeries coming on March the 20th at 3:30, and you'll be informed by the physician's offices or the hospital regarding what that means to you. And also the non-essential ambulatory services are also, a plan is being put in place to reduce the non-elective ambulatory services, and you will have further information from the physician or the hospital. And that's sort of decline in services to get prepared for an influx of COVID-19 patients, which we hope will not come, but we do expect it will come, is led by Zaki Ahmed, our Chief of Staff.
So again, that's a precautionary measure, and people can expect more information in the next couple of days?
Yes, we're going to have these daily updates, and we're certainly going to have daily communication both to the staff and the public, and as we move this initiative forward. And this morning, as you may have heard, Ontario officially declared a state of emergency this morning, and we're learning more and more what this means to the hospital, and we'll give you further updates what that means from patients, from the public, from staff, as well as the hospital.
So what sort of things is the incident management team working on?
Well, we're certainly meeting probably 4 or 5 hours a day. We certainly want to make sure we communicate appropriately both to the public and our staff. We're certainly putting in safety procedures to make sure essential care continues, but we're also getting prepared for any type of urgent influx of COVID-19 patients. But right now, we have a lot of questions about human resources, and certainly human resources is actually assessing the impact of our pandemic plan in terms of vacation. Sometimes if we're closing some departments, we'll have staff to redeploy into other areas. We're looking at sick time, self-isolation, and other areas. But certainly as more and more information comes, we're going to have a Q&A with our staff, with our sort of leaders, and certainly that's why we require the daily updates.
Wonderful. Really important to point out that the entire team is coming together, working through this situation, and the healthcare providers are really the heroes today. Are there any changes that you'd like to report?
Yes, I mean, our screening table, so every patient, visitor, staff that comes into our hospital are being screened. So no one gets through our 4 screening areas, and we screen on a daily basis as they come in and out. So make sure when people come to the hospital, they're safe and they're not carrying infection with them. Our whole goal is to avoid transmission of this nasty virus within the hospital environment. So, but work has to be continued. So, and staff, we don't want staff waiting in long lines. So we're developing an app, so you can actually fill in your app before coming to the hospital that answers all the questions, and that will allow for you to seamlessly move through the screening points without having to stop for questions. You still have to be stopped if you have positive those questions as we move that initiative forward. So I'm hoping that app will be available within the next 24, 48 hours for our staff.
Wonderful.
Also, it will help reduce delays, and again, as we move forward, we keep on fine-tuning every day that this initiative is moving so quickly, so rapidly. More news is coming from the federal government, the provincial government, so we need to actually be a bit fluid in our response. So if we do want feedback from our staff and from the public, whether we're doing a good job or how we can improve on things.
So you noted visitors coming through the screening process at entrances. Can you clarify the difference between a visitor and a patient family advisor and visitor restrictions?
Yes, so right now, there's no visitors allowed at Thunder Bay Regional Hospital. The only individuals we're allowing that we don't put them as visitors, we put them as care partners who are actually involved in the care of their loved one at the hospital. And each patient can identify one care partner to be their care partner throughout their hospital stay. And that's the key. So there's no visitors, there's just care partners at Thunder Regional Hospital.
Wonderful. And something went out yesterday around sick notes.
During areas like this, we also have to protect our primary care physicians, our community physicians. We want to sort of decrease access to those areas except for essential sort of office visits. So we do not want our sort of patients, we do not want the community going to their doctor with sick notes, and we sort of plead to the employers not for asking for sick notes during this time of crisis, because we need to free up the healthcare system for more pending emergencies.
That's wonderful. Everyone needs to be responsible.
Yes.
Thank you, Dr. Kennedy.
Okay.
I know you have a lot of
Okay.
work to do. We'll let you go.
Okay.
Thanks to everyone. Stay healthy, stay safe.
Thank you, Tracy.